actually interesting because you were talking about like the effectiveness, and I have actually found a study in 2009 that listed 12 different medications by their effectiveness. So what they do in a drug trial is they take these drugs, they have the person that's on the actual drug, and then they have the person who's on the placebo drug.
Right.
And hello, puppy. And then what they will do is they'll go through the list and find out how effective the medication is, and however, how acceptable it is. And what they mean by the acceptability is they study how likely a person is going to stay on it based on side effects.
Okay.
So, yeah, actually, none of the ones that you had mentioned are on this list. So, darn. Which is actually kind of funny, because now I have no idea how I managed to do this, because I put the effectiveness and then the accessibility, and I drew lines.
Yep.
So, if you can see it, there.
Yeah, just bring it back a bit more.
But the very first one, I have no idea where that's supposed to be on the list, because apparently I didn't draw a line.
Gotcha. Gotcha.
This is the list that's here. I'm not going to sit here and try and pronounce them, so if you can see them, awesome. If not, zoom in. Very interesting that the last 3 on the effectiveness is also the last 3 on the acceptability list. And the fact that I actually have never heard of these 3 probably shows how often they're not used.
Okay.
The Tricyclics Antidepressants, just to give an example, if it's drop in blood pressure when standing, you feel like you're sedated, you have dry mouth, constipation, urinary retention, blurred vision, dizziness, weight gain. These are also meds that I've never heard of. The selective serotonin reuptake inhibitors, which is the SSRIs, which is a lot of what people are used to hearing. There are common side effects of nausea, diarrhea, sexual dysfunction, insomnia, and fatigue. And Prozac and Paxil and Zoloft are all on that list, and so is Celexa and Luvox. It's Luvox. I've actually never heard of this one, but all the other ones I had. Anyway, as you can see, side effects can go, it's a huge bubble of side effects. Like, it's really hard to say what you may or may not experience. So, in true social media form, we went off and asked on Facebook and Twitter of personal experiences or what people feel about antidepressants. And somebody that I know, who I've actually known for quite some time, actually gave me their personal experience, and it kind of blew me away because I had never heard of the side effects happening from any meds before. They feel like having to pick between the lesser of 2 evils, like whether or not to take the meds or to just not be on medication. Psychotics make them shake and tremble to the point of muscle weakness and cramp. They want to eat more, lowers their metabolism. It makes them tired all the time, and tricks the body into thinking it's pregnant. And of course, I had to question this one because I had never heard this before. And apparently, gain weight. If you can gain weight, your period stops as well as you start to lactate. Anyway, those are some of the side effects that I'm used to hearing, like the brain, as I call brain farts, or the brain spasms, the brain tremors. You have foggy brain, dry mouth, fatigue, and weight gain. I've heard of all of these before.
Yeah.
So, and they went on to tell me that it increases or decreases their blood sugars, depending on which one they're on, which creates diabetes, which while doing the research, I found out.
Yep.
And in general, makes them feel worse about themselves more than they did before the treatment.
I will tell you, being on clonazepam plus Cymbalta together puts me in a freaking coma. The side effects you just mentioned about your friend, regarding it convincing your body it's pregnant, like, that has got to be some kind of, like, mind fuck.
I have, for some strange reason, I want to say it's the clomipramine or clonazepam or something like that, but I didn't write it down, and I need to look it up.
That's scary when it can transform your body that much. Like, fatigue issues, fine. Shouldn't drive, fine. But faking a pregnancy and frigging with your natural body's menstruation, not fine. No way. No way.
They have actual medications for that stuff.
I know. Yeah.
So I totally understand, after doing a little bit of this research, I can understand why people would stop taking it. Because if you are one of those, like, I don't know, the 10-20% that has the adverse extreme side effects, I can totally understand why they stop taking it. There's a lot of people who are very split. One person said one of the main reasons people experience these is due to chemical imbalance. I must have missed something. If the medication can help restore that balance to the affected person can start getting back to a normal lifestyle, then I'm all for it.
Mm-hmm.
However, they know somebody who takes the meds to help their anxiety, and if they forget to take the meds, it's a very hard time making it through the day. So in other words, and it goes back to taking a med when you're prescribed to.
Yep.
A lot of medications are time released, so it's very critical for you to take that med at like 9 a.m. if the doctor tells you to take it at 9 a.m. The person is very split on the use of medication. They think that it is fine, but should be used as a last resort in conjunction with other therapies. And oftentimes, it is a first resource, such as Ritalin for children or ADHD, and leads to additional problems down the road once the body and mind become immune to it. Now, Ritalin and ADHD is a whole other topic that I'm not going to get into today.
I was just going to say the same thing.
And another person said, medication is necessary for many people to properly manage a mental illness, whatever mental illness that may be. However, through my personal experience and professional experience, I would suggest that some doctors are too quick to prescribe medication and are not providing patients with enough information about counseling, like talk therapy, cognitive behavioral therapy, etc. A prescribe it and forget it approach leaves the onus on the patient. I think we've seen some positives in our healthcare system's approach to mental illness, but we still have a long way to go.
On the Canadian Drug Policy Coalition website, they asked, does Canada have a drug problem? So that talks about, illegal, both legal and illegal substances that do exist, and we do use some on a daily basis. Substance use has its risks. They do talk about that, and I'm not going to because it'll prolong this video, but this is a very good website. Like I said again, it's the Canadian Drug Policy Coalition, and you really should go read it because it explains everything here in Canada about drugs. Check out this website and just see what they have to say. I like taking action. It says our drug laws are outdated, unpopular, and unstable. And they have an entire survey that you can fill out and submit.
All I'm going to add really was that if you are somebody who is feeling the more extreme side effects and your doctor is just telling you that it's possibly inside of your head, don't stop there. Advocate for yourself and tell them, like, look, this is not working for me. Like, maybe mentally I am feeling better and more clear. However, these other things it's not working for me because it's having an effect on my life, on your daily life. So you really have to try and push, and maybe your doctor and you will have to sit down and discuss an alternative and hopefully find something that gives you the same mental clarity as well as physical clarity. So
again, thank you for this chat. I know we are a couple days late uploading to YouTube this time. We do apologize. And next week we will be on schedule, and you can look forward to a new video on, what is it?
I think we're going to be doing postpartum depression.
Thank you, and don't forget to subscribe. Talk to you next week.
See you later.
Bye.